units, and some of you guys have Zoll in your areas. So 8 North, you have Zoll. Where were you from, hon? Dialysis will be Stryker. You're Stryker. You're going to be urgent care, so you're going to be a community AED. 512 has primarily Stryker, but if you have a kid that's under 25 kilograms, you're going to have a Zoll on loaner. So you're going to need to have an awareness of how to use both of them. So you guys kind of set yourselves up where most of my Stryker people are over here, my Zoll people are over here. For convenience, you may want to move to this side just so that you can see the Zoll while we're looking at them. Okay, so we're going to say that you guys took your patient, you got floated to your RMC today. And you guys are taking your patient down for a simple x-ray, nothing big, and all of a sudden your patient goes unresponsive, doesn't have a pulse, isn't breathing, and you needed to start CPR. Somebody brought in a defibrillator for you guys, and you've activated the code team, but there's no advanced team here yet. So let's talk through getting the defibrillator out and going and everything. So for the Zoll, where's the on button for this one? On top. Good. So we can start that one up on top. For the Stryker, where's the on button for this one? Green. Yep, the green on button here. Okay, how do we choose our pad sizes?
Look on the pads.
Look on the pads, yeah. So your pads will tell you, this one, the baby ones, is 0 to 15 kilograms, and the bigger ones are more than that. For Zoll, same thing, just look on the pads. The pads will tell you the pediatric ones are for anybody 0 to 8 years of age or less than 25 kilograms, and the adult ones are for more than 25 kilograms. And yours just open up like a book. How do we apply the pads? True. For the Stryker, you're gonna apply the same as we used to for the MRX. So you're just gonna grab the pads, and it's gonna be anterior or lateral. So they're gonna be just like this. What about for you guys using Zoll? Do you know how to apply the Zoll pads? Yep, you're gonna just follow the picture. So I have some trainer pads out, and mine, for the purposes of reusing them, they have just Velcro. So it's gonna look a little bit different in real life. Yours aren't gonna have Velcro, but you would essentially apply the center sticker, and this little feedback device here, you want the X, the cross, to sit in between their nipples on the center of the chest. And then the back one for the pediatrics goes, follow the picture, goes right in the center of the back. For adults, it goes slightly off to the left. Okay. Anybody know what the purpose of this is? Where we're gonna put our hands for the Zoll. It's gonna give you measurements of how deep you're compressing, what your rate of compression is, and give you some more feedback on how you're doing. Unfortunately, the Stryker does not have that aspect built into it, but it will give you some coaching. All right, so we have pads on our patient, and we'll just pretend these are on. Forgot to tell you guys, sorry about that. The monitors are set up both the same, where you have monitoring cables on the left and your defib pads and your defib cable on the right. Same thing with the Zoll. So for you guys that are gonna be 512, where you're gonna primarily have Stryker, but if you have a kid under 25 kilograms, you may have this on your unit. So monitoring is on the left, and your defib pads and your defib cable are on the right. How do I hook up the defib cable for the Stryker?
Attach it.
Yeah, it just slides in. The nice thing is that the with the old MRXs, you could accidentally put it in backwards. You had to remember green to green. You could put it in backwards and get it stuck. These ones, they only go in one way, so you just literally slide them into place. Same thing with the new Strykers. It's a big honking cord, but they only go in one way. You just take your cord out. Your pads are right here. Just make sure I have the right one. And they're gonna slide in like this. Okay, so we have somebody doing CPR on our patient in this code situation, and we didn't know what to do. We turned it on, but we're not really sure what to do. This probably doesn't look all that great, but I don't know what rhythm this is. Clearly there's a problem with this side. What do you think we should do?
Start CPR right away with
Okay, we have CPR going on. Anything else we can do? What? Any other ideas? Do these have an AED mode?
Yes.
Oh, yeah.
Okay.
Mhm.
So if we don't have a provider present, we can consider putting it in AED mode. Sorry about the beeps. How do I put this one into AED mode? Anybody know? There isn't actually an AED button anymore, so you need to look for the button that says, the area that says analyze. Where does it say analyze on this one?
Right here. Yeah, that rectangle.
Right there, okay. So we're gonna hit analyze, and it's
Stand
gonna
clear.
talk us through the prompts.
Press shock.
If it detects a shockable rhythm, it's automatically going to charge. And then you're gonna wanna make sure everybody's cleared from the victim, and you can go ahead and push shock.
Perform CPR.
Sorry about the beeps, guys. It wants to tell me that this is a lethal rhythm, so that's nice. Now, after it's shocked, it says, okay, we were aiming for 50, it actually gave 70 joules. It's giving us a countdown timer to let us know when it's gonna go off again, and it's keeping us stats of how often, or how many times we've shocked so far. I'm just gonna turn this one off.
Does that one do that too?
Not quite, they have
Okay.
similar functions, but slightly different. Okay, so, I don't know why this is slinging. What a way to have this video recorded, right? Okay, how do I turn this one into AED mode?
Is there like a select button and you can dial it?
Yeah.
Kinda, it's gonna be the same thing as this one. We wanna look for the button that says analyze. So where is it on this one?
On the left,
Upper left.
the CPR button there.
Okay, right here?
Yeah.
Okay, so I'm gonna hit analyze.
Analyzing now.
It's gonna
Stand
talk to you.
clear.
Tell you to stand clear. If it detects a shockable rhythm, it's gonna automatically charge
Shock
to 200 joules.
advised. Stand clear.
And you wanna make sure that
Push
everybody's
shock
clear from the
button.
victim. And you can go ahead and discharge that shock and immediately resume CPR. Now there are a few differences
Start
about this one.
CPR.
This one also has a metronome that automatically comes on and is gonna give you kind of like a pace setting to do your compressions at. It's gonna anticipate that you're doing 30 to 2 compressions, thinking that it's more of an older
Stop
person.
CPR.
So
3, 2,
Once it gets to
1.
30 beats,
Ventilate.
it's gonna tell you to ventilate.
Ventilate.
Oh, cool.
Press.
Turn this one off. If at any time you wanna stop this, cause it's getting to be too chaotic in the environment, you can just hit this little CPR button that's lit up with a green button on it, a light, and it'll stop that metronome for you. This is also gonna be counting down to let you know when the next 2-minute AED check is. Now, this machine is set up more so for adults. It can be used on pediatric patients, but the AED mode is automatically gonna discharge at 200 joules, then 300 joules, then 360 joules. The hospital went with this primarily for adult units because adults tend to have more heart disease and sometimes need a higher dose level that most of the other defibrillators can't go up to 360 joules, but this one does, so that's why they went with this one. The caveat is it does not have a pediatric AED built into it. Our MRX, our old MRX defibs did not have a pediatric AED built into those either, but they were started out at only 150 joules, so we got away with using them on smaller kids that were greater than 10 kilograms. Because this one is gonna automatically start out on 200 joules, it should not be used in any patients less than 25 kilograms. And there's an orange sticker here to remind you not to use it in AED mode if it's less than 25 kilograms.
Push. Analyze.
I'm just gonna turn this off for a second so we don't have to listen to the beeps. If you guys on 512 happen to have a patient less than 25 kilograms, you wanna have a Zoll loaner on your unit so that you have the AED that can dose for pediatric patients should a provider not be present in the event of an emergency.
Push. Analyze.
This one can be used on pediatric patients less than 25 kilograms. You just need to have a provider present to diagnose the rhythm and tell you how many joules to dial up. This one will sense what size pads you put in, as long as you're using the packages that look like this and say Zoll. If you attach adult pads, it knows to defibrillate at 120 joules. If you attach pediatric pads, it defaults to defibrillating at 50 joules in AED mode. There are some other pads that are third-party pads. They're for like doing during X-rays and stuff. You guys won't see these that much. These ones that aren't made by Zoll, the Zoll machine can't distinguish which pads you'd have in, so you'd have to go in and change the patient profile to adult or pediatric. But I would say that I can't think of any instances where you would have these pads. You're probably always gonna have the Zoll pads. So your machine will always sense what size pad and what AED dose to give. Okay. Any questions so far about AEDs? Okay. Let me turn these back on. I'm just gonna hit analyze again to get it back to where we were.
Analyzing now. Stand clear. Shock advised.
Stand clear.
Stand clear. Push shock button.
Press shock.
Start
Perform
CPR.
CPR.
Okay. Let me just switch this into. So with this one we can see how many joules was administered, we can see the countdown time, and the number of shocks we've administered. The other thing that this does is it provides CPR feedback as we're compressing. So you can see that I'm doing 2 inches deep and at a rate of about 112 right now. So it's giving me feedback as I'm compressing the patient. If you're using the bigger pads, it'll actually give you more feedback, and it'll tell you how well you're recoiling off your weight off the chest and how well you're perfusing the victim. They don't have the measurements for peds because there's big size variance, but you'll get more as you go to the adult pads. So that's a really cool feature too. What happens if the advanced team arrives and they want to take it out of AED mode? They don't want this going off in 50 seconds. They want to be able to look at the rhythm and decide what dose they want to administer. How would we take it out of AED mode to put it into manual mode? Any ideas? So it's actually going to be the same for both, so it's a little bit nice that way. We're just going to hit the energy select button. So right here, it says analyze, right next to that is energy select. This brings us up a new menu to be able to choose what energy setting we want. Same thing with this one. It's right here is your energy select buttons. You can hit up or down, it doesn't matter. This one will allow you to toggle up and down, or you have a speed dial, which allows you to quickly rotate through it, anywhere from 2 up to 360. For you guys, yours is just like this, where you're going up and down with the arrows. So let's say that they wanted to defibrillate this time with 150 joules, and for you guys with 300 joules. So you program that accordingly. Now what do? Somebody's doing CPR, what else are you guys gonna do on the machine?
Charge.
Go ahead and hit charge. What for you guys? Same principles, yep, so we're just gonna charge. Now what do?
Push shock.
And right before we push shock, we wanna make sure everybody's clear. And same thing for you guys, make sure everybody's clear from the victim, and then you can push shock. Okay. What if we had to cardiovert a patient? What's the difference between cardioversion and defibrillation?
Depends on what rhythm they have.
Okay, so we do defibrillation and cardioversion for different rhythms.
You have to synchronize it to their heart.
In cardioversion, we synchronize it to their EKG rhythm. So the way I kind of think about it is if we're defibrillating somebody, they're in a fatal arrhythmia and they're essentially dead, and we're gonna just send a whole lot of energy to them. If we're cardioverting somebody, they may or may not be conscious, they have a pulse, but it's not a great rhythm and we wanna try and get them out of it. We're gonna synchronize it to deliver it at a specific point in the cardiac cycle, and it's gonna be a lower dose. So how do I tell these machines that I wanna do cardioversion rather than defibrillation?
There's a sync button somewhere.
Sync buttons on both of them, good. So on this one, it is right here, and as I hit the sync button, let me just switch this to a different rhythm. This is an example of SVT. As I hit the sync button, you guys are gonna start to see little green arrows above that. And then, I don't have SVT on this one, I have AFib, so I'll just put it into AFib over here. I've never had this beep so much at me before. And then for you guys, do you know where your sync button is over here? Yeah, so there's little soft buttons along these that change. And so there's sync right here, and we're gonna hit this. Yours is a little bit more visual. It's yellow S's and yellow tick marks. So that's, you're telling the defibrillator, hey, deliver the dose right here. So how do we dial up those energy doses? If the provider asks for 10 kilograms, how do I do it? Or 10 joules, how do I do it?
Isn't that like the arrows that you kind of
Yep, just like for defibrillation, we're gonna use the energy select arrows. Or it could take a while with this one. The nice thing is that you guys have this, so you could go to 10 joules. What about for you guys? Yep, the energy select, and then I can go down to the 10 joules. Now what do you wanna do?
Charge.
Charge it. Your patient's probably awake. Let them know what's going on and that it's gonna hurt.
Sedate them.
And if their blood pressure is okay, try and give them a little bit of Versed or fentanyl or something to sedate them, because it's not a pleasant experience. And then we can go ahead and charge. Clear everybody out of the way and hit the red lightning bolt button. And same for you guys, we can go ahead and charge. Clear everybody out of the way and then hit the red lightning bolt button. All right. How do I power these down? Oh, one thing with cardioversion, if you're giving depending on, you have to hold the lightning bolt until it discharges. Usually, if we're doing in peds, their heart rate's 220, so it's gonna be a split second. But if it was an adult in AFib and their heart rate was a little bit slower, it's gonna wait for the R wave, so it might be a little bit longer. So just remember to hold it until it discharges that dose. All right, say everything was good, the patient's better, they're breathing on their own, we've hung out with them for a long time and we're ready to leave. How do I power these down? Yeah, oddly enough, this one, the green on button is also the off button. I think they should have said on/off, but they didn't. But this one, just so you know, you have to hold it in for a little while until it powers down. You guys? This one is just the green on button on the top. And again, just hold it in. This one doesn't take as long to power down. This one's a little bit longer. Do you guys have any questions on defibrillation or cardioversion with either the Zoll or the Stryker? Okay, we're good. What do you guys think